how do we manage the resistance to this? Because there is going to be resistance to this change.
It is going to be resistance, and it's going to have to be, as it comes. You got to be able to deal with it. If you have, again, you're in a healthcare organization, and you have patients who are, let's say, in long-term care or whatever, or not even long-term care. You have patients who come in who are negative and nasty towards all the people of color who work there. They need to get services somewhere else, because you're taking a stance as an organization and saying, that's not acceptable here. It's not acceptable here. Now, will that require you, would that look like a loss for you at times? Absolutely. But the long-term gain is going to be so much more. It's going to be so much more for you, because you'll get it right. And now don't get me wrong. Let me make this clear too, because I think a lot of people have taken what people are trying to help others understand over the years, and especially now. I am not saying that, I'm going to put on my Oprah voice that all the Black people want to be in all the leadership roles. I'm not saying that, right? But I am saying that we've got to make sure that we are creating true equitable processes in all that we're doing. If you're hiring people, make sure that you're looking at all the managers are looking at all the resumes and not throwing out Shaquita Jackson because of her name, when Shaquita may have more experience, more education than Dick Jones, right? And Dick Jones gets the job, and Shaquita Jackson, she doesn't, and she has to go work as a clerk somewhere when she's management material, right? So it's a lot. This is a lot, you guys. It's a lot that needs to change in the workplace. A lot. Am I too much for you guys? I know. Oh, you guys
this is your hour. My question is, so where does our responsibility for those people that we're meant to cut off begin and end? Because I'm always worried about leaving people in a bubble. And I've been friends with people who, by modern standards, I suppose would be racist, who it'd be, I suppose, more obvious for you, Angela, in dealing with them. But, if it's just me and them in the room, they'll joke and then I'd say be polite in their dealings with people of other races. But subconsciously, they might not even know it, but still support systemic racism, thinking well, they shouldn't be rioting, stuff like that. Without moderate voices around them, what's the fate of them if we were to cut them out? Do we leave them with some sort of resources so that if they want to educate themselves, they will?
Tom, you have to become the voice, right? If you are educating yourself, you're taking in new, I've put together a whole packet of resources for people to leverage. If you are educating yourself, and if you are doing what I call the HEART change for this HARD change that we're driving, and you are ready and you are in that seat of change, and you are now the voice. You got to be that voice. So when I say some of your friends may need to go, not after you give, opportunity to try and help them understand. I think you're absolutely right. Cutting people off without at least giving some nuggets of gold to help them try and be better and try to change. I think that's, important to do. But how long do you keep trying to do that? That's your choice. That's your call. But you have to know that your communication of what is no longer tolerated is what you have to say to them. You know what? If it's between you and Dr. Joe, let's say Dr. Joe regularly says certain disparate comments that are no longer acceptable for you. What are you going to say to Dr. Joe? Let's role play right now, Tom. What are you going to say to Dr. Joe?
Dr. Joe, this pattern of vilification, I think it's a little bit hypocritical, the way you've been so gung-ho with things like, anti use of force. And yet now suddenly, you're seeing people getting kidnapped but in unmarked vans by plainclothes officers. And now it's, well, they should behave. This weird about face is very strange, and I'm not a mind reader, but maybe a little bit telling. So I don't know. Maybe take a look in the mirror. We're on public radio, so I'll cut it off there. But
yeah, so it's being able to do just that. How you can't control you, Dr. Joe. I've noticed you said that a few times. I got to look up at my notes on my screen. I've heard you say
no one, you influence
where you talked about change.
Yes,
you can't change Dr. Joe, but you can give input and try and influence Dr. Joe to make a shift and make a change. It's about that influence that has to be core for you. And I think until we can do that, we won't again see the needed change long term and the sustainable change. That's what's important.
And we have to change a little bit right now.
Stretch the